Okay, and welcome to session 4, the Science of Relationships, Adult Attachment Theory, Level 1. My name is Dr. Zach Bine, and the first of the insecure attachment styles that we're going to cover is preoccupied attachment. If you recall, our last lesson was discussing secure attachment and what that means and looks like and feels like in the world and how that happens. So this is the beginning of our discussion of the insecure styles. So the preoccupied dilemma is one which there is high anxiety and low avoidance. So one can see with low avoidance there's going to be a lot of exposure, and with that exposure will come the high anxiety. And if we go back to the strange situation, which is always helpful, we noticed there were two kinds of anxious ambivalent infants. That there was an angry kind and a passive kind. Both experience overwhelming distress at separation, but the angry infants at reunion would switch between active overtures for connection and expressions of rejection, such as leaning away or throwing a tantrum. The passive infants at reunion, there were only faint or implicit requests for soothing or consolation, as if they were too overwhelmed to approach mother. We saw that mothers of anxious ambivalent infants were unpredictably or occasionally available, insensitive, and discouraged the infant's autonomy, perhaps explaining the ambivalent infant's fear of exploration within the strange situation room. These are just examples of ways that could create the dynamic of caregivers being only inconsistently available. As a child with needs, you learn what you must do or not do in order to get your needs met. Sometimes they learn to throw a temper tantrum as the only way of getting attention. So preoccupied parents have a chronic misattunement to the exploratory system of the child. What does that mean? That means that regularly, they do not attune when the child displays any exploratory behavior. Exploratory meaning wanting to discover things on their own, wanting to pursue their most unique, independent sense of selves. That's perceived as a threat to preoccupied parents. Why? Because it takes the child away from the needs of the parent. So as you can see, there's a role reversal here. The result of preoccupied caregiving is the child ends up with an over-involvement and identification with the parent's state of mind. Parental responsiveness is inconsistent. And this could be for several reasons. Perhaps the parents have demanding careers which take them away from the necessary attunement needed at a young age. Perhaps the caregiver struggles with an addiction, or the mother and father are in a stressed relationship with regular conflict, the child relying and needing the parent to meet its needs. We have the parent relying and needing the child to meet their needs. The child is expected to regulate the parent's state of mind and thus becomes chronically hypervigilant to the state of mind of others. And you can see how that's possible. As the anxious, resistant child grows into adulthood, now a preoccupied adult, there remains an inhibition in their exploratory behavior, which interferes with healthy self-development. So you can see how the preoccupied attachment gets passed through the generations. And I want to go back to the AAI to use it as a way of discussing this attachment theme. On the AAI, preoccupied parents were deeply absorbed in their own troubles and concerns about attachment. The interviews are excessive, confused, angry, or passive. They demonstrate a fear of abandonment, a helplessness, a pervasive anxiety. Their past emotions would overwhelm them in the present moment. They would alternate between discussing childhood episodes to discussing a current attachment grievance. They would quote, they would imitate, sometimes have childlike language or even vague nonsense words. There would be run-on sentences and fragments, and it would really pervade the transcript of the interview. Intense fear, anger, or passivity in past and in current relationships prevents coherence and collaborative discourse. Their speech tends to be confused, tangential, lengthy, and discouraging of autonomy. Now let's talk about being in relationship with a preoccupied person, which some of us have. In relationship with a preoccupied person, having a consistent focus on their self-experience is of utmost importance. They grew up with an outside-in orientation, taking in what is happening around them as a way of survival and getting their needs met. In therapy, we work toward developing an inside-out orientation, where one looks inward to find the answers and have them expressed outwardly. If you are in relationship with someone preoccupied, keep a calming, consistent presence, even in the rise and fall of coherence. Remain patient. Selectively attune to exploratory words and behaviors. This allows the preoccupied person to begin to think about exploration as a possibility. This is also done within the 3 pillars system. As an example, I will read a script of a generic session one might have with a preoccupied adult within the ideal parent figure and 3 pillars framework. You don't have to be worried about their state of mind, and if at any time you start worrying about that, Imagine that these ideal parents are emotionally responsive to you, and they make a comment about your internal state and bring you back to yourself. They notice all the subtle changes in your mood, moment by moment. What a relief to not have to worry about their state of mind. Really take in what that feels like. They act in a way as to calm and comfort you physically. You can feel the gentle touch, and it's reassuring. And verbally, they're reassuring you that it's all okay. Everything is all right. And you respond to this in a way that dampens your anxiety. And you become more and more calm, taking in that calming effect now. Everything is all right. It's all okay. And now notice the growing desire to explore in new ways and discover in new ways with the support of these ideal parents. As with trying anything new, you might have anxiety. So imagine ideal parent figures that are constantly and consistently attuned with touch and verbal reassurance, constantly soothing, constantly comforting. Really take that in. So the goals are as follows. Number 1, correcting for the outside-in orientation. Number 2, regulating the inner child's anxiety. Number 3, having ideal parent figures who are attuned to a range of emotions. And number 4, encouraging exploratory behavior with the ideal parents as support. Having a preoccupied partner means that there will be ruptures in the relationship. If ruptures happen, step out of the attachment language and go to the third pillar, which is collaborative abilities. Collaborate. Address that they are wandering off track. Teach them turn taking. Help them clarify what it is that they're saying. In terms of metacognition, they're deficient in mentalizing. Often use your own experience to help the preoccupied person contact their own experience. For example, saying, "I imagine that was very scary." From a meditative perspective, preoccupied adults have difficulty containing their emotion. In meditation, we practice containment of emotion. The body learns that it can raise what neuroscientists call the window of tolerance, or the amount of stimuli one can endure before going into dissociation or overwhelm. So if you're in relationship with a preoccupied person, know that they have to strengthen their capacity for emotional balance, self-esteem, trust, and don't reinforce that they can only get your attention through amplifying their stress. Illuminate their strengths, their goals, and desires, because being preoccupied with connection overshadows those. Know that the apparent helplessness is a defensive posture to help the other person feel good, to ensure closeness. know that they have an approach withdrawal strategy, that they're consistently in crisis, that they would often beg for help and then withdraw from it, and that they chronically reenact unresolved trauma. In order to access empathy for them, we must get in touch with our own understanding of helplessness, of chaos, and the difficulties of life. We all have our own measure. Limit setting can be very useful if you're in relationship with someone preoccupied. Not in a punitive way, but if you do X, I will do Y. If you make the dinner, I will do the dishes. We must be able to tolerate their anger, blame, and helplessness. Try to illuminate their dissociated wishes, beliefs, and desires that often is conveyed through their behavior, but not verbally. They can't tell you. But be aware of your desire to be the rescuer or to be idealized. Be a secure base rather than the rescuer. Do not become overprotective, as this reinforces the hyperactivating strategy in the preoccupied person. So don't deal with the surface level helplessness. Rather, connect with what is beneath. And often what is beneath is a fear of abandonment and a lack of independence. The preoccupied person is often lively and vivid, often overwhelmed by their feelings, absorbed in avoiding distance from others, maintaining closeness. Yet they're filled with self-doubt. They're fearful of independence. They could be angry, chaotic, helpless. Research shows that they have trouble harnessing the linguistic and analytic left brain. Diagnostically, they are histrionic to borderline personality disorder. And often they have a sort of helplessness. There's a great threat of separation and isolation, so they will try to merge with their partner, because if they're merged, then how could their partner ever leave? So unpredictability of early attachment figures taught them that they need to amplify and exaggerate their distress just in order to be seen. I wanted to touch briefly on the importance of mentalizing. The practice of labeling or noting one's experience as it arises and passes away increases insight, but it also decreases emotional arousal. It does this by enlisting the brain's analytical regions. And as I just told you, these are the regions that, for preoccupied people, are less active, so it would be good to train. Mentalizing fosters a calm and unguarded state of mind from which previously repressed or dissociated feelings, thoughts, or sensations can come into consciousness. Only then can they be resolved. It also adds new context to old and troubling memories, holding them with acceptance and ease, and it integrates the left and right brain